Bring this in. All right, so welcome everyone. It's great to see so many people responding to having interest in the COVID informational session today. And thanks for logging on to Zoom again after these many months of Zooming. I want to welcome our guests. We have a couple guests from the Tompkins County Department of Health. Dr. William Claypack is the County Health Department Medical Director. And then we also have Samantha Hilson, Director of Health Promotion and Public Information Officer. I am Zach Nelson. I'm the Senior Program Coordinator with the Greater Ithaca Activity Center. I'm hosting this with a few other organizations. And I guess we'll keep everybody muted except for the presenters. I think we're going to have a brief synopsis of where we are in the county currently, current conditions, and then we'll open things up for Q&A. If you can enter your questions into the chat, that would be the best place to pose them from, and we'll operate under those methods. So I'm going to turn that over to Dr. Claypack and Samantha Hilson, and thanks again.
Thank you, Zach. I believe it'd be good to start off with a little bit of an overview, and I'd be pleased to do that. And good afternoon to everybody, and welcome. And we look forward to hearing your questions and answering them for you, and providing you with the best information we can bring together. As you know, we had a honeymoon period back in June and early July, up to about mid-July, and then we entered into what we could call the India variant time, when the Delta variant took over, and we entered into a very bad time and a very heavy workload for the department and a lot of cases. But I'm pleased to be able to share with you that over the last 2, 3, 4 weeks, national data has shown a downturn in the number of cases. And now we can say that locally, we also are seeing a downturn in cases. You can also very safely say that any case of COVID that's occurring is due to this Delta variant. In excess of 99% of viruses that are tested turn out to be the Delta variant. And as we turn into this downturn in cases, we have to realize that case numbers are due to a variety of factors. One is vaccination, how many people are vaccinated, and we still have a number of people who are not vaccinated in our region, and of course across our country. And secondly, the precautions we take. Are we using masks? Are we socially distancing? Are we using common sense in limiting our exposure to the virus? As you know, I'm sure, a sizable number of cases have arisen in vaccinated individuals. The good news is that the vaccine does protect them from severe disease. But as we go forward, even as we see this downturn, our case numbers are dependent on the common sense we employ in conducting our daily activities, and we can go into that more. Currently, our case numbers on a daily basis are ranging between 10 and 20. A few weeks ago, we went through an upsurge as higher education opened up. Cornell, Ithaca College, TC3, we expected to see case numbers go up, and they surely did. Not long after that, public school opened up, and we anticipated that we would see some case numbers go up with the opening of public school, and they certainly did. Fortunately, in these last few days, those school-based numbers are lower. And many of the cases that we are dealing with are related to community spread of the disease. We're ranging, as I said, between 10 and about 30 cases per day, and we're averaging about 20. Our overall case numbers reached an overall high of about 470 back in early September. I'm glad to say now that our numbers are now down into the mid 100s, and that's certainly a blessing. We continue to have positive cases identified, as I noted. People tested, about 0.49% of them are positive tests. Fortunately, most of them, as you can see, are negative. And we still are seeing about a 50-50 split to some extent between vaccinated people and people who either are unvaccinated or it's uncertain what their vaccine status is. The current national level of the coronavirus still has many hotspots in it. So for people who are expecting to travel, they need to be aware of whether they're getting into a very risky situation if they're going within the state or outside of the state. The United States currently still ranks on a global basis as a hotspot, ranking right up there with Mongolia, some parts of southern African continent, the British Isles. So we aren't out of the woods yet. The possibility of another variant arising in the future is always there. And I think that'll be strongly dependent upon not only our vaccine status, but also the precautions that we take. If you are vaccinated, it reduces your risk of being hospitalized by more than 17 times. So although you are seeing vaccinated people end up in the hospital, in our local hospital, part of that is due to the fact that we have a high vaccine rate. So when we report out residents of Tompkins County who are in the hospital, because we have better than 70% of people who have had at least one vaccine, better than 75% who have had one vaccine, and better than 70% who have been fully vaccinated, that vaccine level means that when there are cases, there are likely to be some vaccinated people in the hospital. But don't lose perspective. The risk of being hospitalized is 17 times less than if you were not vaccinated. And we should keep that in mind. Later, we can go through some of the developments, exciting developments in this last few weeks. The approval of the Pfizer vaccine for booster vaccination, for example. And this latest announcement by Merck that they're approaching the FDA with a drug that may fulfill part of what we've been hoping for, a medication that can reduce the risk of being severely ill when taken in a timely fashion. This drug would be somewhat similar to the influenza drug, Tamiflu, for example, that can be taken if you take it early enough after becoming symptomatic with influenza to shorten your duration of illness and severity. We can talk more about this Merck drug as we take questions and talk about things. And lastly, I'd just like to point out that vaccine safety remains a concern of people, but we have had no red flags of any new data that would show that these vaccines are anything other than a real blessing. Yes, there are some side effects, but my goodness, they're extremely unusual, even to the point of being some of them rare. And so we can, with confidence, move forward with the vaccines, using them. And as we have initial data about the younger age groups, and now the age group of concern is less than 11 years of age, those groups as well. So far, the data is reassuring that the vaccines are not only safe, but likely to be as effective as they have been with older individuals. So with that, Zach, I may have taken a little bit too much time. I'll turn it back to you, and maybe Sam would like to add some comments as well. Thank you.
Go ahead, Samantha, if you like.
Sure. Yeah, well, I think we can, that was great, Dr. Klebeck. And I think that, we can jump into questions. We did receive a few from Zach. One thing I think we would like to highlight are the recent booster doses that are available for the Pfizer vaccine. So that at this point, if you received the complete series, so 2 doses of the Pfizer COVID vaccine at least 6 months ago, you can now receive a booster shot, so a 3rd dose of this vaccine. And we just announced that the county with the health system is going to have some clinic specifically for these booster shots later this week. And then probably well over a month ago, it was authorized that individuals who are immunocompromised and meet eligibility could receive a 3rd dose of any of Moderna or Pfizer vaccine. And for the booster, Dr. Klebeck may be able to speak more to this, but we are waiting for additional data and approval from the federal government regarding Moderna and Johnson & Johnson for that booster shot. So happy to answer questions about those as well. And I'll put a link to the upcoming clinic in the chat. Zach, are you okay? I'm
hearing you.
Yeah, okay, all right. And then there is a question in the
Well, I'm just losing you for losing there. Are you your audio just kicked out? I don't know if it's for everybody. Why don't you lean in again and start?
Is it all right now? Yeah, okay. And there is a question from Paula in the chat about a different variant than Delta. I don't know how to pronounce actually the new variant. And that also, the link that I posted does have some information from New York State about that variant. And at least right now in New York State, it says that this end of September, that it was estimated 0.1% of samples came back. So you can see that there's a huge difference between the prominence of Delta and this other variant. Not to say that this other variant couldn't take more, couldn't become more present, but right now that's the data that we have.
So we had a question about from Vicki McDonald on is there a different dosage amount between the Pfizer 3rd dose and the Pfizer booster shot? And is it expected that immunocompromised individuals that receive a 3rd dose will eventually need a booster as well?
The dose is the same for a Pfizer booster as it is was for the 1st and 2nd shots. Probably it'll be the same if Moderna and Johnson & Johnson also become approved for that. It's not clear, and there hasn't been a definite answer to the immunocompromised individual who gets their 3rd dose, and then at what point, or do they get a booster? But I would expect that as time goes by, there will be guidance coming out from the CDC. It probably will be about the same. It probably will be 6 months. and a booster, but we don't know that at this time. And just to emphasize that the third dose for immunocompromised people is constitutes what would be their primary series, that they need more doses in their primary series than do people who are immune competent and have a normal immune system.
Also like to follow up. Is there any time frame when the booster for Moderna would be available? And could you comment on the practice of mixing and matching the various vaccines?
Well, Moderna does have data into the CDC for consideration. And likely they would be the next to get approval for a booster. How quickly that occurs, I'm not certain. But we know that from the time that Pfizer submitted their data to when the FDA made their decision was really only a matter of a few weeks. And likely the Moderna would follow suit. Johnson & Johnson has just begun to submit data to the FDA. So probably pretty quickly after Moderna, you would see Johnson & Johnson coming up. Now, mixing and matching is basically comes into a theoretical issue rather than one that's addressed in guidelines. There is no guideline, there is no official recognition, and there is no data to really substantiate how mix and match, that is to say, a person who got, say, Moderna or Johnson & Johnson initially, and then gets a Pfizer, there's no real data to say what that does to their immune response. Some experts in the field believe that it would have a beneficial effect, but really the data on that, although it's, I'm sure, being collected, I haven't seen it, but I'm sure people out there are looking at it, that has not been analyzed or looked at in any concrete way. And so we want to stick to science. We want to stick to what we can stand behind. And we do know what the data is for Pfizer. We will know what it is for Moderna and Johnson & Johnson. And sooner or later, something will come up about mix and match. But at this point, it is not a recommended strategy.
So I have a question from Joanne. How much of a difference does the booster make? How has the current recommended time period of 6 months after which one could receive the booster been determined?
The time frame came about from looking at a mix of information. Some of it is laboratory information, looking at people's antibody levels, seeing how they trend upward after vaccination, how long they persist at a high level, and then how they begin to drop down. The challenge there is to know what level begins to make a person vulnerable to COVID. That data still is kind of preliminary. What is the minimal level below which you are really vulnerable again? What we do know, though, from other data, there was a VA study, for example, looking at disease and time from last dose of vaccine. And they could demonstrate a rise in cases as you got out to many months after the last dose. I can't, off the top of my head, quote to you that VA study as to when, say, for example, what were the numbers like at 8 months afterwards or 6 months afterwards. But this type of data, real world disease data, coupled with laboratory data about antibodies, fed into the recommendation of 6 months following the last dose of Pfizer vaccine.
Thanks. How about a question from Myra, responding to common sense behavior? What about having dinners indoor with a group of people who are all vaccinated? And then she put another follow-up question included it, as well as what are the drivers of community spread locally?
The drivers are actually gatherings where you have numbers of people getting together, particularly without using any precautions. And of course, as the size of a gathering goes up and the distancing between people goes down, the probability of a virus being able to be spread goes up. So it's a proportional thing, isn't it? And everybody, the thresholds are very variable. So if I'm going out to a friend's house and I'm going to join them for a meal or something, I want to have a sense of what that friend is doing, whether they're vaccinated or unvaccinated. Even if they're vaccinated, are they like going to concerts? Are they, there's some really wild stuff that goes on out there. Are they using precautions? Are they being reasonably careful? If they're vaccinated, my risk as a vaccinated person is certainly much, much reduced in terms of the probability of contracting COVID. But if I don't have a real sense that they're careful people, and if there are going to be a number of people in that group where, gosh, who knows what they're doing, I'm gonna want to think about that. If I can't be socially distanced, at the extreme, I may not go. I might have to regretfully turn it down. On the other flip side of the coin, if I feel very confident, these are people I know, that's a horse of a different color. So as we go forward, I think all these considerations are very important, just common sense considerations, really.
As far as community spread, is that primarily at Cornell among the students, or is it branched out to the community at large?
We'd be as a community, I suppose, we'd be very lucky if it was only at higher education, but it's not. Certainly the Cornell cases are Cornell students being our community members as well. Certainly a lot of them occurred in group settings, people that went to bars, people that gathered in large groups. But the same has been true of the community, people who have gotten together. Household contacts are extremely important. Spread within a household, so that either from parents to child or parents to other adult members and so on. Group settings, earlier on and not so much maybe recently, travel was showing up very prominently. People would travel for a birthday to be with family or a wedding, a funeral, whatever, and not always use masking, etc.
So Gwen had a question. Do we know the risk stats for folks who get the booster yet? And why are immune compromised individuals allowed to mix and match vaccines?
I think the mix and match for immune compromised is probably more of a pragmatic decision than a purist decision, if you will. So certainly the immune compromised, we know that they have a special need for augmenting their immunity, and not always possible for them to get that third dose exactly as they got in the beginning, although it is certainly encouraged that they do so. But rather than remain vulnerable as immunocompromised individuals, the mixing of the vaccine was deemed more appropriate for that higher risk group. Let me think, I'm thinking back. What was the first part of your question, Zach?
Do we know the risk stats for folks who get the booster?
Right. So in the studies that were shared from Pfizer with regard to the third dose, the side effect ratio and the character of the side effects were really no different than in the initial series, in your primary series.
And then one final one from Gwen. She asked, how likely is it that someone who is vaccinated will contract COVID when outside in a large gathering?
Well, we know that when we look at the numbers of people vaccinated and unvaccinated in our county and look at our cases and how many vaccinated individuals versus unvaccinated we have, that the unvaccinated are at least twice as likely to get infected. So the vaccinated individuals about somewhere around half as likely to be infected. And of those infections for the vaccinated individual, they're much more likely to be in the mild to moderate to even asymptomatic category.
Oh, well, that's a good lead into the next question was, what's the likelihood of carrying the Delta variant without symptoms, even if you're fully vaccinated?
I don't know of an exact number to attach to that off the top of my head of all, in other words, of all COVID infections in vaccinated people, what is the percentage where they're asymptomatic? We knew in the beginning of the pandemic that we thought it was like up towards of 40%, so pretty high. We discover asymptomatic vaccinated individuals largely through routine surveillance testing. So it may turn up in, say, someone who's going to have a procedure and they have to have a COVID test for some reason before the procedure, or if they are in an employment situation where they need testing on a surveillance basis. We turn up asymptomatic infected people that way.
So I've got a question from Myra again here about testing. Is it irresponsible due to cost to get tested because you went to an event and are concerned you might have been exposed? How quickly, how much cause should we have to run up to the mall to get tested?
Well, I don't think of it as irresponsible at all. I think of it as community, as fulfilling your sense of responsibility to the community. Again, the threshold for thinking of getting tested, I think would vary depending upon how you perceive the risk of what you were in, either anticipated or unanticipated. Sometimes we find ourselves in situations we didn't anticipate would be as risky as we thought. So subsequently being tested is a prudent thing to do. How long you should wait after that, say going to some event where there are lots of people you didn't anticipate being there, or people you didn't think, you thought they'd be wearing masks and they didn't. It's usually well to wait at least 3 to 5 days if you're a vaccinated individual to be tested. There is an incubation period for COVID. It's thought to be still for the Delta around 2 days. It may be as long as 14 days. So there's no real perfect time to do it, but somewhere around 5 days is probably a good time period to think about it, 3 to 5 days. That way you're not walking around infected without knowing it for a long time. And yet, if you're going to be positive, about 50% of people become positive 5 days after exposure, about half. So some still could become positive later. So I don't think of it as an irresponsible thing at all to do, to get tested.
Just curious from personal experience, over the past year and a half, there's been days that I've woken up with a headache, slight upset stomach, and I mean, you immediately think, "Oh, is this it?"
Yeah.
And I mean, there's so many of the symptoms of COVID are fairly common. Just you don't always feel 100%. How quickly should I respond by scheduling a test and when I'm not feeling 100%?
Well, I think you can certainly monitor yourself for a bit of time, the rest of that day. Is this something that, I don't know, I have a sore throat, but maybe I slept wrong last night, those kinds of things, we know how they clear up. It's usually within the day. And then, what do you have planned? If you're a person who works remotely and really aren't in contact with other people. On the other hand, if you're living with an immunocompromised individual or somebody who can't be vaccinated, you'd probably be quicker to get it done. There are, as you point out, these symptoms cross over with the common cold. They cross over with influenza, which is one of the reasons why all of us should get our flu shot this year, and make sure that we don't get confused about influenza or COVID. But yeah, I think if those symptoms are persisting for a day or so, you should give serious consideration to checking it out, making sure.
Okay. So once again, you led into the next question nicely. Vicki was wondering about having the flu vaccine at the same time as you have a COVID booster, the safety of combining those.
Yeah, fortunately, there's no need to separate the COVID vaccine from any other vaccination. And this is important for your grandkids and children who are getting childhood vaccines, or for adults who need a routine vaccine. You do not have to separate COVID from any of those vaccines. What's the worst that can happen? Well, if you got, say, your flu vaccine and your COVID vaccine at the same time, and the next day you're feeling under the weather, you won't know whether it was the influenza vaccine or the COVID vaccine that gave you those symptoms. But there's no synergy. There's no combining effect where they're going to put you into a serious state compared to taking the two of them separate. And it's sometimes best to vaccinate right when you're thinking of it, so you don't accidentally forget to do it. I mean, we're all busy, even in COVID times, and it's so easy to let that influenza vaccine slip by without getting it, or the booster.
Right. Lil Cohen was wondering, is there a difference between contracting the virus without symptoms as opposed to being an asymptomatic carrier?
If you contract the virus without symptoms, you certainly will be a carrier of the virus. You'll be certainly contagious from the virus for a period of time. We believe that vaccinated people are contagious for a slightly shorter period of time than if they're not vaccinated, but you will be contagious for a period of time. And if you are symptomatic and vaccinated, symptomatic and vaccinated, your contagious period will be quite similar, we believe, to being asymptomatic.
How about another question on testing? What's the false negative rate on antigen tests?
It's pretty much a 50-50 proposition. Antigen tests, I think, do have a place, but their place needs to be carefully thought out. So I would point out a couple of things. First of all, anybody who does a home antigen test, and so no matter where that antigen test is done, if they have a positive antigen test, they immediately should get in touch with their personal physician and get advice as to how to care for themselves, and to begin to isolate. A positive antigen test must be presumed to be significant, even though it's 50-50. And they should isolate and protect their family and loved ones and friends from COVID. So that's one thing. It also must be reported to the health department. But these antigen tests, sometimes they're ones where you do them at home and you run the whole thing and you get the result at home. And there you are, all by your lonesome, nobody to talk to, about what do I do? What's my next step? And that's where you want to get in touch with your personal physician, but you also want to let us know at the health department, because we need to go on and assess whether anybody else has been exposed. For 2 days prior to contracting COVID, a person is contagious to other people for 2 days. So we have to go back and ask you about any exposures you had. We'll also advise you as to how to safely get a PCR test to confirm whether that antigen test was truly a positive one. But it needs to be done safely, and we're glad to give you the advice. Antigen tests, sometimes when you buy the kit, you send it off to somewhere else and presume maybe that will get reported, but they aren't always. So it's a real Wild West kind of thing about antigen tests. They don't always get reported where they need to be reported. So make sure that we know if you have a positive antigen test. And this gets very complicated, I'm sorry. With an antigen test, if it's negative, it's again only a 50-50 proposition. If it's negative and you have symptoms, don't trust it. If you have symptoms that could be COVID, you need a PCR test, and you need to isolate until you know whether you have a positive PCR test. So if you have a negative test and you have symptoms, don't trust the test. If you have a negative test and you had a really scary exposure, you probably need to retest again, the next day or so. Maybe it's too soon for the antigen test to be positive. Maybe a PCR test would really be a better choice. And it's important to, even now, so far into the pandemic, Tompkins County Legislature has made funds available for Tompkins County residents to be tested at the testing center with PCR tests at no charge to them. So it's speaking loudly that that we as a community value people getting tested and knowing for certain.
Maybe Samantha would be a good person to answer this. This is a follow-up on that point. Is the mall the sole testing place now? How does one go about scheduling online? I'm sure. Are there other ways if people aren't computer savvy?
Yeah, that's a good question, because our testing locations have changed throughout the pandemic. So right now it is just the mall site, that old Sears building, or behind the building. And it is drive up, and really you self-test. So they've gone through some different types of testing too. And so I believe the most current test is a nose swab that you do yourself. It's not the super deep one that was originally done. It's a little bit lower, so people can do it themselves. And it's also, though, very sensitive and reliable, and is that PCR test that Dr. Claybeck was speaking to. So the hours for the mall, I can also post in the chat, but you can still register online or through the call center that Cayuga Health has. And it's open business hours, I believe, during the week. And then I think they do have some Sunday hours as well. So testing is available through the mall drive up. And then the downtown site was closed in the spring. So that's the main thing right now.
And it's requested that you register. It's not just the drive-in situation that you're supposed to have an appointment.
Yes, you should register. Yeah, and 211 can also assist folks in registering for testing, and also for these booster shots for appointments. So if folks are not able to use the internet or navigate that, then they can also call 211.
And Sam, if I could add one thing, I think many private practices have the materials to submit a PCR test to the medical center for processing. So your practitioner's office may well be a place also.
Mm-hmm.
So there's a couple more questions in the chat here. Joanne's interested in knowing some local restaurants are not maintaining a 6-foot distance between diners anymore. How important is that 6-foot distance? I guess intrinsic in that question, since it's diners, those are going to be people that are sitting without masks.
Right, and COVID, even the Delta variant is by far predominantly spread through the air. So having enough distance to let any virus dissipate is important. When I go to a restaurant, I try to pick a table that's pretty far away from everybody. And I'm not shy about asking the waitress, well, how about that table over there? So I try to pick and choose, and I try to eat outdoors if I have a choice, just so I'm more distanced and better ventilation as well, of course.
So if it was an indoor dining situation, how would you feel about the being seated less than 6 feet?
I myself personally, and it's a personal choice to a large degree, I think, I would be very nervous. I would want to move away. I might not eat, I probably myself wouldn't eat there. I would choose to say, well, thanks very much, but.
So I have a question on taking, is it okay to take a painkiller if one reacts to the vaccine?
Yes. Most of the time, the strongest painkiller one would need would be some Tylenol or aspirin or a non-steroidal like ibuprofen or Motrin or something of that sort. None of those interfere with the vaccine. It's usually not needed to take it before you have the vaccine, sort of preemptively. I don't think there's any real need to do that. Waiting until you see if you really need it is probably the best way to go about it.
So I don't see any more questions in the chat. I do have another question. But if you are thinking of something, now would be the time to put it in there, so we can still get to it. My question, it hasn't been relevant for me yet, but I wouldn't be surprised if at some point it is. I'm wondering what happens if I lose my vaccine card and I want to be able to show proof. Is there a methodology for dealing with people like me yet?
Yeah, so this has definitely happened already. We get calls here at the health department about it, but any healthcare provider, physician has access to a system in New York State, as everyone's immunization record. And so it's called NICIS. And so any primary care doctor, for example, should be able to look up someone's vaccination record and give them a copy. So that is likely going to be a replacement. I don't know of actually getting a new vaccination card. It's possible if you misplaced it and went to get your booster, for example, at the mall site. They do have vaccination cards, so they may be able to replace it, but most likely it would be just having a record of your vaccinations.
Thanks. Situational question again. What about going to the theater or a concert when vaccinated and masks are required? Do you consider this safe for older adults?
My choice would be to try to sit, relatively apart from other people, wearing my mask at it. As an audience member, it's it's a sedentary activity, so nobody's shouting or singing or etc. So that helps to limit the spread. You probably want some assurance that the facility had appropriately increased their ventilation in this time of COVID, so that the air turnover is increased, so as to help with removal of any expired air. But I think within reason, yeah, I think it's a possible thing to do. And many of the functions even require people to be all vaccinated, which of course increases safety as well.
Yeah, and I would just add that, for the very good questions about, these types of leisure activities and, going out to dinner or getting together with friends and family, that I think all of us relate to just the mental health aspect that we all have been very affected by during this this ongoing pandemic. And so I think that I think Dr. K would agree, hopefully, that within reason and with precautions taken as best as you can, I think that we've all been living with this for quite some time, and that you also have to evaluate sort of your own level of risk that you're comfortable taking, but again, with some precautions in place, that you may decide to do some of these things that you enjoy and that give you some of that social interaction that again we all really need.
Yeah, that certainly is a very valid point. And I think most theater and concerts venues would only have people who are, within that family group or whatever, sitting close together, and they would encourage spacing and do other responsible things. We might talk, Zach, a little bit about school, because I think seniors, as far as our risk profile, if you will, we always think about kids well, gee, can I get together with my grandchildren, or what about being with young kids and so on? We know influenza is easily spread by children to adults, and And we know that adults can spread COVID to children and children can spread COVID to other people. One good thing is that as far as we know, we have not seen any spread of COVID within schools. We have had cases identified in kids at school, but by and large, we think that most all of these have been brought into school from the household or from some community contact. And that schools are being very diligent in trying to reduce the risk of transmission within the school system. So you all know about the masking mandate that came. There are, the Ithaca City system is doing routine surveillance testing of students on a schedule. I believe it may be weekly. I could be wrong about that, but it's on a fairly frequent basis for kids whose parents agree to this testing. So they're not only doing their other precautions, but actually doing surveillance. And other districts as well are considering and are doing screening and surveillance to the extent that they're able. So I think we as seniors can look at our grandchildren and say, okay, what else are they doing out there in the community? You know, kids are now able to resume soccer practice or dance lessons or whatever, right? So knowing more about, okay, what activities are they doing and how careful are our kids being with our grandkids and so on, that probably is what needs to weigh into our thoughts, even far more than the actual school system part of their daily life.
So I got one more question that just came in a little bit ago, and then maybe we'll wrap it up after this. It's about testing again, and does the testing site give a card with basic information about how to get results? This person recently talked with someone who had gotten a test but was confused about follow-up and getting results. People often can't focus, you know, when they're in the midst of the testing experience and may not remember. So what's the methodology for people educated in their results?
Yeah, that's a good question. And you know, I think it has varied a bit on if there is a physical handout that is given out at the mall site. I know at some point they did have a brochure, but that may no longer be the case. So the best way is that if you register online ahead of time, then you're in the Cayuga Health system, and you should receive an email. If you use email and entered an email in your registration, you receive a note that says that your result is now updated in your portal. That's all online. If you don't use email and don't use the online system, then I would recommend calling the call center at the site, and they should be able to look it up and assist folks. So that's probably the two best options.
Yeah, and it's always good to be proactive. If you aren't hearing the result within a reasonable period of time, don't be shy about going after it. Don't wait for them to call you. You know, if you haven't heard, find out.
Well, I appreciate both your time and everybody that tuned in. Maybe we'll wrap things up there.
Jack, I might offer just a little bit of a closing statement, if you
Sure.
will. As I look into my crystal ball, looking into the future, which is a dangerous thing to do with COVID. But when I look into my crystal ball, I think I do see boosters coming along probably for Moderna and Johnson & Johnson, as we've said. We had Merck Merck company begin to apply to the FDA for approval of a medication which could be taken by a person who becomes symptomatic with COVID, as long as they take it within 5 days of becoming symptomatic, that Merck says will greatly reduce the chance of severe disease. If that proves to be true after all the data is peer reviewed and it's scrutinized carefully, if that proves to be true and that medication is approved, that'll be a great blessing because it will add to the monoclonal antibody treatment that we have to prevent severe disease, and it will be a much more easily accessible treatment than treatment which has to be injected. And going down the road even farther, there are several other companies and drug prospects of antivirals that may help us with this pandemic to reduce severe disease and death. They won't take the place of vaccination. The old saying is an ounce of prevention is worth a pound of cure. And the vaccination is the ounce of prevention. The drug is the cure, but does not prevent being contagious, and it doesn't prevent being symptomatic to some extent anyway. What will happen? Will we see a new variant? Again, as I said in the beginning, that's dependent upon many of our unvaccinated choosing to become vaccinated, and for us to use precautions as common sense dictates. And the good news is that studies in the last month have shown a certain proportion of unvaccinated people turning the corner and saying, okay, now I am ready, I am willing to be vaccinated. There are people who have not changed their opinion, and there are some who have reverted from I consider it to being no, I won't do it. But the good news is that there is a segment of people who are now changing to being, yes, I will get vaccinated. So there is some hope as we go forward, both from the many aspects, and I just hope that they all play out going the way that we hope they will. So thank you.
Thank you, Dr. Klapak, and thank you, Samantha. I also want to thank the County Office for the Aging, McGraw House, Lifelong, and Love Living at Home for their help in publicizing this and being a partner. And geez, I hope next 6 months we won't feel quite that it's so critical to get together with you both, but I've enjoyed both sessions a lot and been really informative and appreciate your time. So thank you and have a nice afternoon.
Thank you, everyone. Thanks, Zach, for having us.